I knew I wanted to become a doctor at an early age. I have a somewhat medical family. My mother was a registered nurse who worked in surgery, and my father was an anesthesiologist in a small town in Ohio. And much of our dining room conversation revolved around what had happened that day in the hospital and interesting things that might have occurred. So growing up with that sort of sparked my interest in becoming a physician. Some of the great things about being a plastic surgeon are that it's constantly changing and there are new challenges all the time, so you don't have time to get bored. You get to take care of patients of all ages, which is not always the case in some areas of medicine. And in plastic surgery, you can take care of the very young to the very old and everyone in between, which is very nice. It is a challenging profession, but it's also very rewarding. It's nice to be able to help people on many levels, whether it's from a cosmetic surgery standpoint or in my practice of breast reconstruction for my breast cancer patients. I started out in general surgery and in a trauma center here in Portland, Emmanuel Trauma Center, which was a level 1 trauma center and still is. It was very exciting. It was a great time to be in that arena. And I loved trauma surgery, but I knew when I did my first rotation in plastic surgery that that is the focus I wanted to have for my surgical career. It's always rewarding to help people in any respect, whether it's a traumatic injury or whether it's something that someone else might think is not very important. It becomes important to that individual person. It can be something as simple as the shape of their nose that they've always hated or their prominent ears that they were always teased on the playground about. We get to actually shape the tissues, we get to actually change something and do something really positive for someone, which is always rewarding.